Hello everyone, good evening. Good evening to our webinar on knee injuries, treatment options 2020, and we'll be discussing on ergonomics for different professionals. And good evening to our keynote speaker, Dr. Vijay sir and Ms. Dr. Chandra here who have joined us today evening. Welcome both of you.
Thank you. Thank you.
Thank you.
Thank you so much for joining us in this busy schedule. So we have here Dr. Vijay Kishore Reddy, who is a senior consultant orthopedic surgeon at Apollo Hospital in Chennai. And he's also a joint replacement and arthroscopic surgeon. And we have here Dr. Chandra S, who is a clinical physiotherapist from Chennai. And we'll be also joined with Dr. Mona Pankaj soon, who is the founder and CEO of Ergocure India. She's from Mumbai, and we'll be joined with Dr. P. Nagaraj sir soon, who is the lead consultant at Neuroscience, Sports Medicine, Rehabilitation and Lifestyle from Chennai. So thank you to all our eminent keynote speakers who have joined us today evening. As you all know, we'll be discussing on a very important topic, that is knee injuries. Most of us have gone through various types of knee injuries, from sprains to strains or dislocations and fractures. And today our keynote speakers will be discussing on how to overcome this through the treatments and what are the causes or symptoms. And without any delay, I would hand over to Dr. Chandra, and she'll be taking and welcoming our Dr. Vijay to the presentation. Welcome,
hello,
Dr. Chandra.
Thank you. Welcome, doctor. So today our doctor will speak about ortho injuries. As she said, we'll come to know all the injuries and treatment and what are the care we have to take and all. So let's start, I guess, without any delay.
Sure. So would you like to speak a few words to our attendees who have joined us today?
Yeah. Hi, everyone. I'm Dr. Vijay Kishore Reddy. I'm a senior consultant orthopedic surgeon in Apollo Main, Chennai, Greaves Road. So at the outset, I would like to thank Dr. Nagaraj given this opportunity to speak about knee injuries. So it's going to be interesting topic to talk about knee joint, because if I see about 10 patients in a day, and I see a lot in them knee issues, because knee being a weight bearing joint. The humans, we have a weight bearing joints like a hip, knee, ankle, and knee being most affected joint, whereas the shoulder, elbow, wrist are weight sharing joints. So every one of us would have come across some issues in the knee, and one part of your life. So this talk is going to enlighten about what are the options, what I do day in, day out. After conservative management, one will undergo and then come to me. There are options, and how they do well with these options, and they can lead their life further, and to protect and prevent arthritis, which is the final stage of knee replacement, whom after 50s we do nowadays a lot in a bulk. So if you try to address these issues in an early stage, I think definitely we can beat the early arthritis in our life. That's going to be the motive of this talk.
Thank you, sir. So without any delay, we'll be moving on to our presentation, and welcome to all our participants who have joined us live in the webinar, as well as who are watching us live on YouTube. Thank you. And without any delay, we'll move on to the presentation, sir.
So what exactly I need to do here? I got it. Yeah.
Yes. You may begin, sir.
Yeah, I got it. Yeah. So let us start. Yeah. The topic for today is the knee injuries and the treatment options in 2020. And the reason why I put 2020 is orthopedics is changing every moment. Every year there is a new technologies. Every minute there is something coming new. There is no innovations are coming new. So the treatment options are getting better and better day in and day out. You see, my professors who are done on orthopedics, their practice today, from there, what they have learned and what I taught 10 years back, today it's changing. Orthopedics is changing a lot. So that's why I put 2020. The options are different. So see what exactly I do in my hospital. I deal with all very high quality care of patients undergoing a complex surgeries like revision hips, knees, and shoulder replacements. That's what I do every day. And also, apart from the replacement, I also do a complex arthroscopic procedures like a hip arthroscopy, which we are the first institution to conquer complete hip arthroscopy setup in Chennai Apollo hospitals, and we started doing with complete setup. And also we do a very high-end shoulder and knee arthroscopy procedures. So apart from my profession, I keep my hobbies alive. So I do a lot of cycling, I do tennis, I run, and I also do golf. And apart from it, I read books, I do a travel a lot. So that's my hobbies. Coming to a knee joint is a very, very large joint in our body. You can feel your knee joint, you can feel your kneecap, you can feel your condyles, you can feel your tibia, that is a leg bone. It's what knee joint does. Knee joint does flexion, extension, that is the bending and being straight. And also there is a little rotation movement. That's what knee joint is for. And I've been telling a knee joint is a weight bearing joint. That means it takes the load. So what happens in different degrees of your knee joint, there will be a different load will be falling into a knee. So that's why as age grows, there will be a wear and tear in your joint. So coming to anatomy of the knee joint is made up of two particular joints. One is your femur, that is a thigh bone, and your leg bone is a tibia. And another joint is made by a patella and the femur. So in knee, what you have is the femur and tibia and patella, which are the bones. And you have some patellar tendon, you have a quadriceps tendon, bone ends called cartilage that smoothens the bone, that is called cartilage, and you have some meniscus inside, which is a cushion. So these are the parts and anatomy of the knee joint precisely. I've been telling about patellofemoral joint. It's a plain joint. It's a kneecap and the femur. That's where this joint is formed. And you have a tibiofibular joint. It is a kind of a synovial hinge joint. So apart from it, you have a ligaments, you have a menisci. The ligaments will stabilize the knee. That means if the knee is like this, ligaments will make sure that knee is in momentum. It doesn't allow too much of anterior translation. It doesn't allow too much of posterior translations. And the side ligaments like a collaterals doesn't allow side by side. So it will firmly, nicely stabilize the knee. So ligaments are very important for your knee joint. So what are the ligaments there in the knee joint? There is something called ACL, there is something called PCL, and lateral medial collateral ligaments. See, the knee range of motion starts from minus 10 degrees of hyperextension. It goes to 155 degrees of flexion. This is a very peculiar grade joint movements. So what happened in elder patients where you're slowly going obese, you're turning over, your thighs are becoming big, your legs are becoming big, so you won't have 0 to 155. You will have somewhere around 0 to 90 degrees of flexion, and further because of the extra muscle or a fat and extra thigh, you have restricted of the flexion. So coming to the knee pain is something that you afflicts millions of people every day. So if you see, I'm going to talk about the statistics which happens in US, but every one of us will have some injury into your knee joint. Either it may be a direct injury to, when you're walking in the house, when you hit something, your patella started hurting, or you got strained when you're coming, when you're coming down to the steps, or, when you're walking, when you're jogging. So knee is the most affected joint in our body. If you see the statistics which I've just taken from US, so you see 100 million Americans suffer from chronic pain in the knee, which is the second most common cause of the chronic pain itself. 1/3 of all Americans report experiencing the knee pain at some time or other. And knee pain is often the result of too much of weight on the knee joint, knee point. So this is something which we need to think about it. So knee injuries are generally caused by twisted injuries, bending forces applied to the knee, or direct blows such as injuries from falls, sports, and accidents. See, what are the things one need to be very careful? What are the symptoms? These are the symptoms when your knee, there is a giving away symptoms, like when you have a laxity, which I was talking about. A kneecap feels like slides out of the place, which is like your MPFL deficiency, where you also we call as a patellar instability, which happens. One need to address that if you have that type of problems. These are all problems which comes into knee. I'm going to talk each and every single point in a future slides. I'm going to talk briefly about it. See, meniscus is a very, very important thing in your joint, knee joint. What happens? The bone, the cartilage of the leg, of the thigh, and down is the bone and cartilage of the leg. In between the cartilage, there is a cushion which is called meniscus. Meniscus is just like a soft cushion in your joint, which stabilizes, which act like a shock absorbs in your joint, in other words. So if you don't have meniscus, there will be a direct bone-to-bone rubbing, and then there will be a wear and tear, as simple as it. So one need to know that meniscus is very, very important part in our body. So that's why whenever we see there is a meniscal pathology nowadays, before we used to do a partial meniscectomy. Initially 50 years back, it used to be open meniscus repairs, open meniscal debridements. Now today we are doing a complete different show. Since last 20 years, we have been doing arthroscopic meniscal repairs. The meniscus act like the weight of the body and reduce the friction of during the movements. It's a very, very important function of the meniscus. So meniscal injuries are very, very common in sports, and all these things, one should not undergo some intervention. They will end up definitely some issues like arthritis in future. So this can be treated well. This cannot treat. You cannot treat this conservatively, because something torn inside, which you cannot go which you have to go physically inside, and you have to saturate. If you don't saturate, the small tear becomes big, and big tear becomes complex tear. Even if you come after some time, we cannot repair it. At the end, we need to do a partial meniscectomy. So if you come in early, we can definitely set this thing right by fixing it. There are the types of meniscal tears. There's a radical tear, there's a complex bucket handle tear, different type of tears. This type of tear is difficult to fix. It requires a lot of technical source to fix that type of tears. So nowadays, what we do all inside meniscal repair. What all inside meniscal repair means, we through the arthroscope, we don't open the joint, we go through arthroscope. We will identify the tear of the meniscus, which is a cushion, and then we will plan to fix it so that we'll reduce the space in between the tear. So we'll fix it with the special arthroscopic meniscal repair set. If the meniscus is completely gone, somebody comes to us with a complex meniscal tear where we cannot repair it. If the patient is very, very young, so we need to give him something for next at least 30 years. We cannot let him go just like that because he doesn't have meniscal repair option possible. So we also think of doing meniscal transplantation, which is we take this meniscus from the cadavers and then we try to keep in the knee joint by opening. And another very, very important structure in our knee joint is a ACL. ACL is an anterior cruciate ligament. It's very, very commonly injured sports ligament in my practice. So this is, what does anterior cruciate ligament do? It prevents anterior displacement of the tibia. This is the thigh bone, this is the leg bone. So it prevents popping out from the knee joint, and prevents hyperextension, and prevents medial lateral rotations of the tibia, and prevent posterior displacement of the femur. So ACL is very, very, very common, ligament which get tear in a sports injury if you don't correctly do the sports. So ACL injuries are more commonly during the sports that I've been telling about. Suddenly stops, changes in direction, jumping and landing. there are between about 1 lakh to 2 lakh ACL rupture per year in United States. See the amount of the ruptures happen in United States, and they all undergo some amount of treatment surgically, and they get back in 6 months back in active sports. This is something very, very impressive happening there. So ACL tears are what happens in ACL tear. ACL tear, you don't have ACL ligament inside, hence there will be a popping up your knee anteriorly whenever you do activities like coming down in the stairs or running or jogging or slipping. You will have this issue. So ACL reconstruction surgery, what we do, some people comes with ACL initial ACL tears, we don't touch. We make sure that they are supple, they are nice, their swelling has come down. We will wait for at least a month, so usually, so that the marrow in the tibia, marrow in the femur settles down, and the knee looks happy, so that it doesn't have much swelling. That is the time we go inside. There are so many options what we do. Very young, highly athletic, like a kickboxer, stuff like that. We do bone BTB as an option for ACL reconstruction. Otherwise, my 80% of the practice I use semitendinosus, the hamstring tendons, for ACL reconstruction. That is completely through arthroscopy, where we through the arthroscope. If you see, this is the done ACL by me. Through the arthroscope, you see the ACL reconstruction done by hamstrings. This is both gracilis and semitendinosus. We fix this femur with a fixed loop in the femur and with the bioabsorbable screw in the tibia. This is how we fix it. We make sure that we stabilize the knee. We make sure that we give a strong knee by doing a reconstructing the ACL tear knee. So the another thing what we would like to discuss is the ACL avulsions. So ACL tears are very common. ACL avulsions are different. ACL avulsion, what is ACL avulsion? You have this is the ACL ligament, what you're seeing in the X-ray. What happens, ACL avulsion is ACL ligament with a small part of the bone. This is called ACL avulsion fractures, where you have a part of bone which is attached to the ACL and pops out because of injury. So before we used to put a screws, we used to have a lot of issues through arthroscopy. A screw which is putting in the joint will cause the problem, will irritate the joint, and sometimes split this bone, which is very small in peripheries. So many things used to happen. Now things are slowly changing. See, this is the part of the bone which is there with the ACL, what you can appreciate very well in the both. This is a CT and this is again a CT picture. So what exactly we do, we try to take a bites on the ACL, and then we will put a small hole in the tibia. We'll put a small hole in the tibia, and then we will take all the bites what we have put on the ACL and bring down to the tibia and put with a button, so that we will reduce completely the fracture part and fix to the bone, so that your tendon is intact, your bone is intact and fixed well. And this is all done by keyhole procedures. By doing this, the bone will heal in 3 months, and patient will be going to the sports after 6 months. The posterior cruciate ligament is a different type of ligament in the knee joint, where it allows and resists the forces pushing the tibia posteriorly related to the femur. So this is there in the back of your knee, this ligament. This is not that commonly torn ligament in your knee. If I see about 10 ligaments injuries in a month, so I will be operating 8 ACLs and 2 PCLs. So ratio is less. It's not like ACLs where you have like US, they are telling about 1 lakh to 2 lakh ACL ruptures per year. So this is a huge quantity, but PCLs are not so. But PCLs are technically more demanding to fix. So this is a PCL injury. The posterior cruciate ligament happens for less often than I've been telling about ACLs. They're very, very less often compared to ACLs. So I was been telling there will be a posterior translation of the tibia compared to the femur. So what we do for PCL tests, once you undergo a physical activity, still your knee is going, you have instability of the knee popping posteriorly. Then if patient is very young and they're into sports, Then we do an arthroscopic PCL anatomical reconstruction by doing again same gracilis and semitendinosus, which is hamstring tendons. We harvest, we fix through arthroscopy. See, this is a well-fixed PCL graft in the knee joint. We fix in the femur one screw and tibia one screw. This is a very great surgery for people who are doing extensive aggressive sports. They require, if they live with this insufficiency, then they will have arthritis. This is I would like to tell here, this gentleman who came to me 2019, John Bokus Tafik, is from Mauritius. He's a world champion Brazilian Jiu-Jitsu. So he had this PCL injury a couple of years back. He came to me last year. He underwent, the PCL reconstruction, and he's won many times world champions in UK and in many places. So he was initially apprehensive that he will prolong his profession or not. I assured him, and I operated last year, and this year he's again back, going back to his championship again. So he sends me after a year. So his videos, unfortunately, I couldn't be able to put. They told me some issues with the videos. So this is how he had come up. And even after 6 months, he's doing his regular activities and he's up and above for next world championship. So it's a fantastic surgery. And there is something called PCL avulsions. I have been telling about ACL avulsions, PCL avulsion. PCL tear, which tear happens in between the ligament, but PCL avulsion happens a PCL ligament with the chunk of bone. Where it is a chunk of bone, we try to fix that bone to the bone. That's what PCL avulsions we do. Before, we used to fix by opening your posterior aspect of the knee. We used to put these screws. Now we don't do so. We try to do completely keyhole, where you don't have a blood loss, everything through underwater. We fix the PCL avulsion with the arthroscopic, completely arthroscopic toto. We try to put a small button on that part of the bone through arthroscopy, and then fix here with another button down, try to fix this up completely. And this will give a tremendous, tremendous amount of results, because you do something through arthroscopy perfectly. The results are really fantastic. They are all back to their sports after 6 months. Coming to the articular cartilage, which is very, very important in a elder part of our group, and also youngsters when they have injuries, initial injuries into the knee. What is a cartilage? Articular cartilage is a white elastic tissue that allows bone to glide smoothly against each other. So it's very, very important structure. If you have issues with your cartilage, it is like a puncture in your tire. If you have a puncture, you need to undergo a puncture, otherwise it will burst your tire. Correct? So same thing with the articular cartilage. If you are young, you have a cartilage defect, which is probably a post-traumatic, then you need to address that particular lesion. If you don't address, then it will become very big and it will turn out to be osteoarthritis at one point of time. So there are variety of treatments you come across today in the world. People do still give injections. I don't give usually much. Yeah, if they are like above 60, 65, there are still chances that I do give a glucosamine, but young patients, I treat them surgically. PRP is coming very new, which is there in practice since last 5 years now in India, probably a little more abroad. So this is having some promising results in a little middle-aged and elder patients. And I do give PRPs even after addressing the arthroscopic cartilage repair. So arthroscopic options for this cartilage, if the cartilage damage is very less, what exactly we do is we debride that complete part of the cartilage defect, and we see the subchondral bone, and we put a small holes on the bone so that there will be a soft cartilage will form on that particular area. It will be filled if it is a small cartilage defect. Hence, there won't be a further aggressive arthritis in future if you try to do this. And also we've been doing a lot of regrow nowadays, meaning taking a healthy cartilage, sending them for lab, and culturing this cartilage cells into millions and bringing back to our ortho OT after a month so, and through arthroscopy placing them in the affected area. This is what we do. So you have a damage. This damage can be done very nicely with your own cartilage. So you come to us, we take your good cartilage little bit in a non-weight bearing area, send them to a lab. We culture these cells, cartilage cells, and we get after a month so, and we'll again take this particular patient into the theater and paste this cartilage cells in the area where it is affected. Hence, there will be a good amount of real cartilage forming there. This is something we have been doing it. Cartilage implantation. I've been telling about this autologous implantation. The same thing, ACI. Now I'm going to talk about the patellar instabilities. You have a kneecap. Kneecap sometimes can have an instability in the kneecap. So there are two types of instability in the kneecap. The kneecap, there's something called habitual dislocation and something called recurrent dislocation. I'm not going to talk about habitual dislocation, which comes because of the abnormality of the bone. I'm not going to talk about it, which comes from the trauma usually. That is a recurrent dislocation, which also can be associated with ACL. So MPFL is a very, very strong ligament which attaches your medial aspect of the patella, kneecap. It will attach the medial aspect of the patella so that it won't slide you too much into the lateral position. So if you when you have a injury into MPFL, that's the medial patellofemoral ligament, your patella will slide easily abnormally. See, and there is a beautiful fixation available for this particular problem today. So if you see this gentleman here completely, your patella is completely popped up laterally, complete dislocation of the patella. See, if you see, this is a normal patella. MPFL is an extra-articular ligament of your knee joint, which is there in the medial aspect of the patella. This is how it looks normal. This is how when it tears. So what exactly we do for it? This is the patella, what you're seeing there in the theater. And I try to put two small holes in the patella. Okay. And then try to fix these two holes with one of the hamstring tendon and fix them in two holes in the patella and fix them with the gracilis. You see the gracilis tendon there, and fix them to the medial aspect of the femur. So it doesn't slide you, the patella doesn't slide after fixing that. It will be rock solid on the femur. So this is something which we have been doing since last 5 years. This is called anatomic MPFL reconstruction. So we fix anatomically points in the patella and in the femur. Hence, the MPFL, the gliding of the patella can be stopped. Coming to the osteoarthritis, we all know osteoarthritis. This is the end story of the knee joint. What is osteoarthritis? Nothing but wear and tear in your joint. Above 50, about 50% of our individuals will start having some pain in your body, especially in the knee joint. Above 80 years, every alternative patient will have arthritis. This has been statistics given by various registries. So wear and tear is very common above 50. So now we have a grading for knee joint. The early gradings are 1 or 2, and the moderate is been 3, and severe is been 4. We have treatment options for all these grades. So we don't do everything for every stage is different. The way we approach. Initially, we start with the physios by doing a good static quadriceps exercises, hamstring exercises, and stuff. So then we come to still the pain is more, grade is increasing. We try to give them injections and then start with the physio again. If it is only medial compartment OA, then we don't do a total knee replacement. If it is only medial compartment OA, we do only medial knee replacement. which is very, very effective at the moment, because I don't see any point of not touching an unaffected knee by doing a complete total knee replacement when there is a only medial side joint disruption. So that's why we address only this. It's a very simple surgery, very small opening, and nowadays we do it as a daycare also. They come in the morning, they go back in the evening, because it's not much blood loss, not much of pain, because we are addressing only small part of the knee joint. So it's very effective, and we have a very successful rates. When you have a complete joint disruption, where we have complete joint destruction, I think nothing works in this place. Grade 4 OA, you need to have two options. One is bear with the pain, live with to complete your life, or have a total knee replacement done and have a beautiful life forward. I think total knee replacement is a fantastic surgery if they have a complete grade 4 arthritis in the knee joint. So the conclusion, the take-home message, if at all you get something for today from my talk, is take care of your knee. Taking care of your knee is very important. If you don't address your injuries in initial stage, then you are going to come with a big problem. So you make sure that you address your injuries. You make sure that if you have injury, meet a local orthopedic surgeon nearby you, diagnose it, get treated, and that's a very, very important thing. Prevention is better, definitely. Always, if you're into sports, make sure that you do a good strengthening exercises, then go into the game. You just don't jump into without doing a stretching or strengthening exercises. That's why I see a lot of tears in your knee. If all my patients are coming to me, they don't stretch completely, they directly go over enthusiastic thing into the game. And avoid overweight. Overweight is something which I've been telling. Knee joint is a weight bearing joint where it takes a lot of load. You must take care of your weight. If you don't take care of your weight, which is just like a tire, it's just it's a brand new tire, comes for 30,000 kilometers. Like that. Our knee joint also comes for 50 years. Very good. You take a more load on a tire, which is 10-ton load. You have to take on that particular tire. You're taking 20-ton load. Same thing. At 20 years, you're 50 kgs, and at 50 years, you're 80 kgs. You're taking 30 kgs extra. So make sure that you don't give too much weight on your joints. Make sure that you maintain weight. If you're already maintaining, make sure you prolong maintaining it. Strengthening exercise is very, very important, especially for the knee. Elders, cycling and swimming is the best exercises. I think cycling is the best. Swimming sometimes becomes very difficult for Indian women to go to the swimming pools and stuff. So I think cycling is the best exercises. And somebody sitting in front of the chair all the time, make sure that you don't sit for a prolonged period. Make sure you don't sit in 90 degrees of flexion. Make sure that you extend into 40 degrees and you start doing your ankle and toe movements all the time. So that will definitely give a very, very big relief. So that's over to you, and I'm ready for any queries to answer.
Thank you, sir. That was very informative. Thank you so much. And we have some questions that have come up here. And I would like to ask you, our first question is the role of steroidal injections in chronic knee pain. The role of steroidal injections for chronic knee pain.
Can you pardon me? I am not very clear. Yeah, I am not getting very clear. The role of?
It is the role of steroidal injections in chronic knee pain.
Yeah, perfect. I can hear her very nicely. So yeah, the role of injections are definitely good in arthritic knees sometimes. There are variety of injections I've been talking about. The steroid injection I've been talking about. Visco supplements I've been talking about. PRP, been talking about. BMAC. These are the injections available all over now. There are a variety of injections. But we need to see what grade of the knee injury. Is it a grade 1, grade 2, grade 3, grade 4? I showed in the pictures. If it's a grade 1, grade 2, sometimes these injections do work. But grade 3, grade 4, where already they have a varus deformity, where they have a cartilage damage, they have knee rubbing, bone to bone rubbing, they don't work in grade 3 and grade 4. Initial stage, in short, it works. Moderate to severe stage, it won't work.
Thank you, doctor. So the next question is, what is the first aid for fractured knee joint?
What is that?
First aid for fractured knee joint.
Oh, this is a very diffuse question. What is the first aid of the knee joint? See, I'll tell you like this. So, if it is any injury to the knee joint, we have to make sure that first you don't first try to whenever I've been seeing these injuries for a while now. So whenever there is some of the injuries happens, I also play tennis right in front of me. It happens. Whenever you injure your knee joint, make sure that you don't try to walk on it first. Try to stabilize it first. Keep some ice packs on it, and with the help of someone, go and see a nearby hospital orthopedic surgeon, so that sometimes even if you have a ACL tear, which happens in very very often in a sports injury, you see the comparatively non-injured knee and injured knee will be having a double size of the knee joint. You have a swelling because any ligament injury will leave some blood inside the joint. So when the blood comes, we need to make sure that we need to go to a doctor nearby, probably aspirate if it's too much of swelling. No swelling, just a crepe bandage and ice packs will do. So crepe bandage and ice pack, non-weight bearing unless the pain goes down, is very important.
Okay, thank you. So the next question is, one of our participant wants to know that one of his friend got injured during football playing 6 years ago. When he went to hospital, the problem has not been fixed. So he wants to know whether it will be fixed or he has to be that injured knee like.
So what exactly happened to this gentleman? He went to hospital.
He went to hospital after the knee injury, but still the problem has not been solved.
So we need to exactly know what is this. We need to definitely see his X-ray pictures, and we need to also see his MRI pictures. X-ray will only show the bone. The MRI definitely will show the cartilage, it shows the ligaments, it shows the cushion, meniscus, everything. We need to see where exactly is the problem. And I feel if nothing is happening next day, I feel definitely I advise my patients to undergo an MRI, so that you will come to know where is the problem lying, and you have a roadmap to do what. I advise him to undergo some sort of MRI of the knee joint and then address the problem. I think that's the way to do it.
Thank you. So the next question is, like, one of our participants, he often his knee often gets bumped into a table, chair, or edge of some object. So he wants to know what he can do.
What happens to his knee?
His knee often gets bumped, slips. So
Knee get?
slips of his knee.
I'm not very clear.
His knee often gets slips of his onto the table or chair. It bumps. That's what he wants to know.
His knee have instability in the knee joint, right?
Yeah.
He had any history of injury to his knee?
No, he didn't mention any injury. He just said like he often the knee gets instability.
So we need to know exactly what's happening to me. We need to definitely examine him. We need to see what is the translation that's happening in the knee joint. Is it coming anterior, posterior, lateral, or medial? I think we need to examine him to give a better option. So I think he must be shown to some proper physician or a surgeon to see what exactly is the problem. It's very difficult to, without examining, telling something.
Okay, doctor. Thank you very much. The session was really informative, and I hope all the participants got their answers.
Yeah, I can see Nagaraj there in the video also. Hi Nagaraj, how are you?
Hi sir, how are you? Fine sir.
Yeah, excellent.
Just held up with the work. Sorry for late joining. So
Don't worry,
I was
don't worry. I
looking
think the
for
talk was fantastic. I hope it's all informative. The only take home message I would like to again tell is like take care of your knee and it will take care of you. And someone who sits a long hours in front of computer in 30s to 40s, 40s to 50s, I would definitely suggest them to not sit for more hours because nowadays, some days I do about 10 joint replacements in a single day. I stand for more than 8 to 9 hours. So because I see them, literally every day. So my only advice for youngsters is don't overweight and maintain your weight. And especially people who are working, are traveling a lot, make sure that they don't sit in one position for more time, more than 40 minutes. Get up 40 minutes, just have a round of 5 10 minutes, come back and sit. Always do ankle and knee extension flexion when you're sitting it. I think that's the way to go. You take care of your knee will take care of you. Knee is like a tire. Tire comes for 30,000 kilometers. Knee comes very good for 50 years. Afterwards is the bonus. Take care of it, it will come to 80.
thank you, sir.
Yeah, fantastic.
Thank you.
Yeah. So I'm done, Nagaraj.
Yes, sir. Just waiting
Okay.
for
So any queries? Pardon?
any other queries, moderator?
No,
Karina?
sir. That's
Any
all.
other question for sir?
No more questions here.
Okay.
Okay.
So I need to quit now, right? Because we have one more participant coming in.
Dr.
Where to quit here?
Sir, you can, Jasila, sir, shall we ask sir to quit?
Yes, yes.
We can quit. We can leave now. We can leave the room.
Yes.
Okay.
And Dr. Mona will be joining.
Where to quit? Is there any button here to quit?
Do I need to give an address, right? Jasila?
Yes, sir, we have he will be joining us now.
No, I just need to address sir, no?
Yes, yes.
Sir, thank you for your excellent
Good. All the best. Stay safe.
Answering all the questions from the participants very beautifully and very clearly up to the mark. And you always excel yourself in your surgery. I know we know much better about you. So thank you
Thank
for
you.
your
Thank you. Thanks a lot, Nagaraj, for that kind words.
Thank you so much, sir. Thank you.
Thanks. Can you help me to quit from here? I have to put any button here to quit?
Sir, you can leave the room, sir.
Just close the tab.
You can just leave it, sir. No problem.
Okay, thank you. Thank you.
Thanks, sir.
Thank you, Dr. Nagaraj, sir, for joining us. I know you have a very busy schedule, and thank you so much. So, would you like to speak a few words to our attendees who are really waiting for you?
What, ma? I can't.
Actually, the audio is not clear. It seems most of the participants are mentioning that the audio is not clear.
Audio is not clear.
Yes. Most of the participants are mentioning in the chat that audio is not clear. They couldn't hear anything properly.
Just you said something, right? Just
Yes, there is some interruption.
could you speak little louder?
Yes, so there is some kind of interruption in the audio. Sorry, attendees who are finding it difficult. I hope we are audible now to the attendees who have joined us live. Sorry for the interruption. Dr. Nagaraj, sir, are you online?
Yes, yes, yes.
Yes. Okay, so sorry for the inconvenience caused. There was some technical issue.
Okay. So, still, ma'am, ma'am will join, right?
Yes, she'll be joining us in a minute.
Okay. I just take the time to thank all the participants who are gathered to this live webinar. First of all, I like to thank Dr. Vijay Kishore Reddy, the senior orthopedic surgeon at Apollo Hospital, Chennai. He's a very, very supportive. When I asked for a speaker, he immediately said, okay, for any application. So thank you, dear doctor, for the kind acceptance of this webinar without any delay and presented all the people and everything on time. Thank you, dear doctor, for your excellent presentation. Indeed, I hear very beautifully the questions answered by the few participants. And I like to thank the participants also. So I can see good number of registration for this webinar. I thank each and every participant from all over the world, especially from India and other neighboring countries. See, like Pakistan, Nepal, Singapore, Indonesia, and a few European countries like Finland, Germany, Austria, yeah, even Austria. So I thank each and every participant for the live, and also the most of the people are watching YouTube. And we are really extremely sorry for the audio trouble here for this webinar. So we are rectifying this, making it all right. So I thank the other speaker, Dr. Mona Pankaj. She's from Mumbai. She's a keyboard founder of Ergocure India. He's a eminent speaker. He does lot of workshops on ergonomics. He's expert this occupation therapist. He does all the workshops related to all the like multinational companies, hospitals, and various institutions. Thank you, ma'am. We're especially waiting for your webinar to get joined. And I thank Dr. Chandra, who is the second webinar. This is a second webinar of who is moderating excellent without any delay or without any applications. Thank you, dear Dr. Mano Pankaj, for joining us. And I thank Dr. Chandra for doing this excellent knowledge. Ma'am, could you start the lecture? Is it Dr. Mona? Is it audible?
Yes.
Is it audible to you?
Can you hear me?
Yeah, I can hear you.
Okay, great.
Start a presentation.
Okay. Good evening, all. So, I just wanted to share that I also attended the earlier presentation, and I was so happy the way Doctor presented. And thank you for letting me share the platform on the same day. Before we begin, I would just like you all to quickly put in the chat box, write in the chat box, what profession are you in? Single word, okay? Somebody, if you could be physiotherapist, occupational therapist, or orthopedic surgeon, dentists, whatever it is, or maybe software professionals, just one word to describe your profession. And I would request the moderator also, if you can help me with the responses as we get them. Okay, great. So today we are going to talk about, okay, there is some disturbance. If you could mute all the microphones. Thank you. Great. No, it's still there. Okay, great. So basically, today we are going to talk about ergonomics for different professionals. Just a second. I need to get hang of the slides. Yes. Okay, great. So a little bit about myself. I'm Dr. Mona Pankaj, occupational therapist by profession. And as everyone begins generally in occupational therapy, we also start with pediatric and, a little bit of neurological rehabilitation for adults. And there is nothing much that we generally do apart from this. I mean, in this field, we do a lot, but nothing apart from this. But as a student, I was always, uh, enthusiastic and keen to learning towards learning this particular field called ergonomics. And as a professional, as my journey began, I, slowly started getting more and more pulled towards it. More so, it happened when I personally suffered from neck pain, and the causes were different. I was probably working on computers for a long time, and there was a stress factor which must have played its role. So primarily when I myself suffered from it and I had to get treated, I had to get an external help, and I was very young that time, and that was the time I decided, no, I have to take charge of it. There is something that I have to do about it, because about if not more, at least about 10 12 years ago, the 2009 11, yeah, about 10 11 years ago, I started, having this problem, and I was younger at that time, and I really wanted to take charge of my life because already I had been suggested surgeries. Doctors said that you may not be able to stand if you don't take up this surgery after a year. You may not be able to, do your things. You may not be able to stand because there was a lot of pressure that was coming on my spine. Okay, that was the time I decided to learn a little more about this field called ergonomics, and it has played wonders. Now, ever since, that's the reason I'm more passionate about it. The more I, see more patients, I try to apply this. The results are amazing. All the neck pain and back pain or pain management patients that I generally, see, um, they don't come back to me for the same reason. Okay, they generally try and take care of their neck pain and back pain just by, putting the right ergonomics in place. So these are the few, you know, um, work, uh, these ones. The work that we've done earlier as a part of Ergocure. I moved to Mumbai, and ever since I've been pursuing this since last 7 years, full-fledged. But the journey began a little, around 2009, 11. So, without much ado, let's come back to this interesting field and why is it important for all of us. Um, how many of you are aware of this term, ergonomics? Moderator, you can read the responses in between. Okay, so
Shall I mention you the occupations?
okay, many of them are occupational therapists.
Like it's what many of them are veterinary doctors are here, dentists, physiotherapists, students of physiotherapy, Unani medical doctors, pharmacists, nurse educators, teachers, dietitians,
Okay.
and
But mostly, yes, allied health professionals are the majority. Okay, great. Thank you so much. Okay, so what is ergonomics? Ergon is primarily a Greek word. Please mute your mic. It's a Greek word. Ergon meaning work, and nomos is laws. Laws of work is what we study in ergonomics. So for me, ergonomics is not only preventive way of working, but also therapeutic way of working, because the moment we correct the postures, the moment we get into the biomechanics, of a person, they automatically start getting quote unquote cured, right? And that's how we get better results, because the body is able to take care of itself, just like the earlier doctor just said, take care of your knee and it will take care of you, right? So that's how it works. So basically ergonomics is taking care of your own body, how to manage your own postures, and how to arrange your own work environment so that your work becomes comfortable. So ergonomics is basically laws of work. Okay, so let us just quickly go through what kind of work patterns are there, right? um, if you're keen on understanding the history, Jastrowski, he initially mentioned or coined this term called ergonomics. Before that, in fact, ergonomics was always there. When Stone Age man, if you remember, they developed their own tools out of stone, right? Why? To increase their efficiency and to enhance their comfort. So those same principles are still in use, and the technology is helping us improve day by day with these two purposes: increasing comfort and increasing efficiency, right? So that's how it began. So what is ergon? For me, it's a calling. It's not only a job or just a career. It's a calling for me now, right? Okay. Now, let's just move. Okay, previous piece. Okay, so what is sedentary work? Okay, so levels of work. We just are trying to understand what levels of work, and so primarily level 1 is sedentary work, where most of us fall into this. Those who are computer professionals or primarily working, those who have more of computer job. I mean, therapists may not fall into this per se because they have a little bit of lifting to do, but otherwise, dietitians, they'll have to sit and write the reports, understand. So it's more or less a sedentary work. So it requires maximum lifting of about 10 pounds, that too infrequently or occasional, and it's more of carrying papers, small tools or file folders, like that. So it also requires only occasional walking or standing. That's what we'll call sedentary, right? Then level 2 is little light work, which involves a maximum lifting of about 20 pounds, and it's carrying about 10 pounds of objects. If a great deal of walking, standing, or pushing and pulling of arms and leg controls is required. So this ways, the levels of the weight that we carry and the frequency is gradually increasing. The medium type of work, where the for example, coolies lift their bags overhead up to 50 pounds, but it is frequent lifting, and that's how it is gradually increasing. Heavy work is again when a person carries load on the head, also involves his trunk, and the weight is also more, about 100 pounds, and frequent lifting is also involved, right? So this is just to identify which work zone we fall into. Okay, so I hope when you are attending as a professional, you take this as for your own purpose. And if you're a healthcare professional, definitely you look at the patient or your client through this angle, through this perspective. Now, where does your client fall into? Where do you fall into? Which category of work? Okay, and very heavy work is these workers which they have to work with objects, lifting of 100 pounds and more, and then frequent lifting and carrying objects, so they have to carry also the loads quite frequently, that way. So primarily, what is work? It is an interaction between a person with the tools, and every person, every profession demands certain methods to be applied to accomplish that work. or to get an end result or a product, right? Why do we call an end result as a service or product? So basically, there are manufacturing industries. For them, work is different, right? There are healthcare professionals, doctors, their work is different. So for them, into manufacturing industry, the work is to create a particular product. These days, what is much in demand? Production of masks and all the PPEs, all of this. So that is so suddenly at a high. The people have deadlines, timelines to meet, the production industry, to just complete these tasks. So how frequently, how long, the duration of the work is to be taken into account. How long the person has to work, how frequently certain task has to be completed, or certain task has to be repeated. Is there any heavy lifting? Is there a repetition? Is there a contact force? All these factors will now come into picture, right? Why is it important for you? Because any profession, every profession, for that matter, will involve some kind of repetition or some kind of demand, right? So, like I said, the production unit will have its own demand. Out of the production unit also, the person who is working on a particular machine will have a certain demand, physical demand, for example, and the person who is supervising will have a different demand. He may just have to take rounds, go look, check, look at it, that every machine is working fine and things like that. Then the supervisor, higher level, would be manager. His work duties will be different, and the top management may have certain different duties to perform, right? They may have more of computer work. So similarly, whatever profession you are in, for example, you're a dentist, you have to work in a certain posture, don't you? Then your work environment also means a lot, right? For example, this particular person who is working in a factory, and you just imagine if it's a lot of sound there, less of light there, would you like to really go and work there day in and day out? Not really, maybe. Why? Because the working condition is not so conducive for people like us who are not used to such things, right? But how, if only we could make the work environment comfortable for these people, whoever is working, the satisfaction or involvement in work suddenly rises, right? So as soon as we are more involved in the work, we are more happy at the work, more comfortable at the work, the efficiency directly goes up. So whatever profession you are into, definitely it applies to you also. So there is a small study which happened, and this study shows this was done on IT professionals, 35,000 IT professionals. Okay, this is much in demand these days. Okay, the ergonomics for office ergonomics, what we call, this is much in demand these days, and uh, so many people are doing this. As therapists have started, taking this up as profession also. Why was it so important? Why was it found so important? First was definitely the paying capacity. The people have started realizing or recognizing or acknowledging their discomforts at work, and they are attributing it to the work environment. So now they are ready to seek professional help. So it's only up to us now how best we can provide them with solutions, right? So this was the incidence of MSDs in India. Okay, out of 35,000 Indian IT professionals, this was the MSD prevalence. Um, so neck pain was about 30%, low back pain was about 25%, wrist pain 14%, hand pain 13%, and obviously if you pursue another study, the results could be different and maybe more stunning. So primarily 75% of musculoskeletal symptoms are related to work, and they say that the most productive employee is the one who is hit the most, right? Because he's working more number of hours. He's he's more uh, enthusiastic or driven towards his work, and he is performing more, right? So the moment he performs more, that means the repetition of the tasks is more, right? So that's how here also in this study, the average age of this of the people of patients was 27 years, right? So 27 years is quite young. Okay, so 75% to 85% people over 30 experience back pain. And back pain, as you all know now, is the second most common reason for physician visits. And it is most important reason for hospitalization, one of the most important reason for hospitalizations also these days. Every so many people get hospitalized just to get treated for back pain. And these days people also find this as an easy way out, just to get a surgery done many times, or get an epidural done, or certain procedures done in the hospital. And whereas they probably don't know that there could be certain things that they could do even before getting into this problem, or even after they are into biggest of problems. I mean, unless there is surgical need, real surgical need required. There are so many problems that could be treated just by applying proper ergonomics. And what all comes in ergonomics? So like I said, this one I think we will just quickly review, because I know that people wish to, you know, get to the point quickly. I hope that you know this. How does it help, right? How does it help? It enhances worker safety, it reduces injury, it increases productivity, it promotes better health. This is all what we know as an employee. And how as an employer it helps? It saves huge company costs, right? Because you don't have to pay the employee for his medical reimbursements, for his physiotherapist visits. You are not wasting your time, your productive time that the employee would have spent in the office when he is going out on leaves for therapy visits, or for hospitalizations, or even for MRIs or whatever. So that's how you save a lot of money. So that's how return of on investment is calculated in ergonomics. So no matter what you do, ergonomics applies to all. So just now, like I discussed, what could be the factors that affect work? Okay. Now, why we are going to discuss factors? Because now these are certain things that apply to all, whatever profession you are in. Okay. So if you could just know what are the factors affecting you, and probably the principles that you need to apply, so that you can take care of your own health, that will sort most of the issues. So we'll just discuss the factors. Like posture, everybody knows, right? Most of the people now know that postures play an important role. How? Sitting postures, definitely. Standing postures, and even sleeping posture. Many people who get up with this thing, stiff neck, pain in neck or spasm, that is so much more happening because of the wrong sleeping posture. Just the way you take a pillow might affect your morning routine, right? So you may get up more fresh without any spasms just by applying a good pillow. So how to take care of pillow, of your neck? Probably, even in the car you could use something like this, stretches, and certain things. The pillow always should be supporting your neck. Okay, the obviously this is a neck pillow though, but you can take a normal pillow and you could just support your neck whenever you're lying down on your side also. So primarily so this is just a tip which you can start following today onwards. Your neck has to be straight and supported. These are the two key rules for even the sleeping posture, for the sleeping posture in particular. So as soon as the neck doesn't have to work or overwork during night, the spasms don't come into picture the next day, right? So straight and supported, your head should not go like this, up or any other ways, right? Human factors. What are human factors? We call them anthropometry. That means somebody is tall, somebody is short, somebody is obese, somebody is, they have different conditions. So, what happens is generally when we design ergonomic products, they design on an average taken from these human statistics, right? So, that means if a chair is adjustable, that is still okay, because then at least we can adjust it according to my personal heights. But if a chair is just taken as an average, okay, but the average could still be high for a short woman, so that ways the regular chair or an ergonomic chair which is not too adjustable may still be a challenge for any person, right? So human factors also make a lot of difference. Stress is something, a silent killer, you can say, silent worker, you can say. That particular thing is so complex that it can also manifest not only itself, not only in your neck pains and back pains, but also so many diseases. So your blood pressure, diabetes are not only related to your lifestyle, but also to the stress levels that you have. So that's the reason stress is so much important. And we consider that into ergonomics because it directly affects your performance. So there is something called cognitive ergonomics, and stress plays an important role in this particular field. Now, workstation, that we all know, right? So especially the regular office ergonomics, right? How high should the table be? How we should place our feet? So just yesterday I made a video on how to take care of your back without using a cushion. So as soon as you apply an ergonomic accessory called footrest, the pressure on the back gets relieved. So certain accessories can help your workstation be more comfortable for you. So even if you're raising your chair high enough to reach the right posture at the table or desk height, the footrest can help you to relieve the pressure on back because it supports the feet, right? um, illumination. Illumination, we all know, lights, right? If there is insufficient light in the room, like I said, if you had to go and visit a factory where there is less light or lot of noise, how long would you be able to stay there, right? So illumination would definitely plays an important role. Now, noise and vibration, the factories that have noise and vibration as a part and parcel of their work, they have to make sure that they have to take care of their employees health in terms of saving their ears also. So they give them ear muffs or certain equipments so that they cancel out, either cancel out the noises or they muff them out, right? So that ways their cilia or hair in the ears, they are saved. So loud noises, people who play DJs, right, they may suffer from this, and that's the reason they put this big headphones. The headphones are primarily to muff their noise levels also. Vibrations, again, so probably not many of you, but some of you may have to deal with this, like the dentists, right? The instruments that you use for scaling or what you call that, cleaning, right, that may have certain vibrations. Now what is important is how long you have to hold that particular instrument in hand, right? And how severe is the vibration, right? Like there are certain things like they are heavy tools or bigger tools, and they vibrate so hard that they have their own impact, right? And repetition. So like I said, how many times a day, and how frequently you have to perform a particular activity also makes a difference, right? So today I'm going to quickly share three important principles that will help you no matter what profession you're into, right? So first principle is work in neutral postures. So going through quickly what are neutral postures, for example, the postures that are right, or they just relax your muscles. They allow them to work in the muscles in easy or relaxed fashion. For example, for the neck or shoulders, relaxed posture is this. The moment your height of the desk is high and you have to reach out for your keyboard up here like this, you're constantly putting a pressure on the shoulder muscle. So as soon as this elevation keeps happening, your posture is not neutral, is what we know. Elbow is about 90 degrees, a little relaxed, more relaxed than 90 degrees. So your typing of the keyboard should happen at a relaxed posture at about 90 degrees, where your shoulders also have to be relaxed, right? So not only keyboard, whatever you choose as your activity. For example, your kitchen work, right? So how high should your kitchen slab should be? um, how big your vessels should be. If your vessel, for example, for a day of a party is too huge, right? Should you use an additional platform to raise your height? Do you think so? Yes, because you need to go deeper. So the moment you do this to reach out to that particular vessel, it is a lot of work, pressure on the shoulder. So, and the moment you raise your height, it becomes a little more easy. That's how, it applies to housewife also. The way the housewife changes the linen of the bed, that also, take care of, can take care of her knees, can take care of her back. How to, change a linen if you have an existing issue. So as a therapist, if you're listening to me, then probably what you need to look for into your client is, does he or she have any existing issue? So then that way is probably his regular work has a certain demand. So one, you need to go and check that first. What is that regular work that she is performing? So maybe that particular work we need to modify first. Second, what is the task she wants to do? And then, because of her existing condition, what is the way or what postures she could utilize so that she can be more comfortable, he or she, right? So here there are other few examples. How, what is the neutral posture for the back, for example? Here, there is, it's supporting the lumbar curve. That's a very important thing. So now when you don't have an additional support, like a cushion, I always, try to put a cushion like here. But if you can go back to the chair and your back is nicely supported, the chair is giving you nice support, then additional cushion may not be required. But if you're not supported by the chair itself, then an additional small cushion, anything, your bag, a towel roll, or a home cushion, or a proper backrest bought properly, that can also help you. Even traveling in the car, that backrest may go a long way. Putting something underneath your feet, or I generally also try to put my feet on the front seat so that the feet are supported for a long journey. That definitely helps. I've kept an ergonomic backrest in the car, so that if it's a long travel, or even if it's a short travel, that definitely makes a lot of difference for me. So you don't realize these little changes, how long they can, help you. So for shoulders and elbows, I told you the posture. So here in this upper picture, if you can see, one person is working down, looking down and trying to do certain things, so that's giving an additional pressure on the neck, right? So the moment you look down, the pressure on your cervical spine increases manifold. So what he has done is he has just changed the incline of his workstation. Okay, rather than working on a flat surface, he's just changed the incline, and the moment he changes the incline, his neck can be straight. That's how little changes can go a long way. The second principle is trying to keep everything in easy reach. Those who are working on computers, they have to arrange their workstations in such a manner that they can easily reach out for that particular thing that they need the most. Okay, that's called work envelope. So for example, you cannot keep a mouse quite distant, or you cannot keep a phone if you require quite often at a very great distance, right? So whatever thing you need more often, you keep it within your easy reach. So that's the work envelope, the first picture, right? Then you can keep the things that you need a little less. Declutter your workstation. Now this I'm talking about computer professionals, but that doesn't mean that it doesn't apply to other professionals. For example, you're a housewife. You need to, that's the reason probably if you can identify now how your parents or your moms have arranged your kitchens. They will have a specific place for the sugar, this thing, tin, and for the tea powder tin. It will always be in the same place, and it will always be within easy reach, right? You cannot keep the such sugar bowl or sugar uh, uh, tin in such a place where you have to bend very frequently, right? So these little things we have to take care while we are arranging our workstation. There are offices where I see patients, they clutter their tables so much with unnecessary things. Certain people they have traveled across the world, and probably they, I don't know what it is, but they want to keep one thing at least from each country. And you won't believe there are people who have traveled like hundreds of countries and you believe these hundreds of mementos from all these countries would be lying on their tables every time they visit outside. But then where is the space to work, right? So similarly, so declutter your table, whichever profession you are in. If you're a dentist, you keep your more important things within easy reach. How much you have to bend, you have to look into that, right? So when I say postures, um, so how much you have to bend, you need to look into that. How much difference would it make if you could change the chair, or if you could change the height of the the chair of the patient, right? What is that thing that is causing you that problem, right? If you have been experiencing some discomfort in the back, sorry, being a dentist, so you need to really know what was that is causing you discomfort. Okay, just so and the third principle is move, exercise, and stretch. Again, so here you don't have to be a certain professional to apply this principle. Whatever you are doing, if you know that there is a repetition involved in your task, stretch in between. If you have to sit for long hours, for example, you're a student, and now these days every class is happening online, right? So you don't have to necessarily sit for all classes. Make it a habit to stand and stretch while attending your classes. So standing doesn't mean that you are not attentive to the into the class, but standing just means that you know how to take care of yourself. The more you stand, it's like, for example, I'm working in sitting posture for an hour, and versus I'm working in standing for 1 hour. I'm losing about double the calories as opposed to sitting, right? So that's how, even if you're looking at weight loss, this is not a bad idea to stand and work. Obviously, when standing, You need to take care of your heels also. Otherwise, long standing hours is also a call for certain professions, requirement for certain professionals like teachers. They have to stand for long hours. Supervisors, probably they have to stand for long hours. In that case, what could be your ergonomic recommendations? Standing on a non-fatigue mat. Okay, that could be one. Or wearing soft shoes, or comfortable shoes, padded shoes. That will take off a lot of pressure because you have to stand for a long time. Not standing on both legs together, and maybe relieving one leg after the other, or keeping one on the platform and then relieving the other alternatively. If you don't have a platform, then just take weight on one leg, and then after some time on the other leg. Wherever possible, do ankle palms, just like the earlier speaker said. So these things are going to go a long way. Now, I would say, how does it apply to you? I just mentioned you can apply it for yourself as well as for your clients, right? You can apply it into daily living. So whatever professional you are, but ultimately you also need to take care of your house, and Corona has taught us all this. So how do you utilize your ergonomic skills to take care of your household chores? That also can help you simplify and perform better, because if you get pain out of your household work chores, how will you perform better at work? So this is how you can make yourself comfortable. Now these are certain things: how to sit in the car, how to sit in the these are the right wrong versus right postures. In the car, if you can see, this person is sitting when his chair height is low. The moment his chair height is low, his knees will go in flexion, and sorry, hip will go into flexion, and there is a pressure on the spine. So these are certain things that do's and don'ts. How we can adjust the car height, car seat height, and all. How to lift our equipments, or everyday need things. Everything. How to tie your shoelace. Everything can make a difference. So see here, how to take care of your laundry, right? How to hold your bags. Everything can make a, even carrying your backpacks. Your children need to carry backpacks these days. Thankfully, they don't have to, because they're not going out for schools. But otherwise, yes, this is a very, very important. Children get scoliosis because they have, this tendency to put the bags. So this is the smart approach. I call this an art, because it is much of a as much an art as much as it is a science. So there are principles. Okay, these are just three principles that I shared in the smart workshop, or the golden principles workshop. I share about 10 principles, and that's how there is a lot of clarity in treating various cases. So these are some pictures from, these are the pre and post training effects. So this much is the difference in fatigue levels and anxiety and drowsiness, some symptom MSDs after our ergonomic intervention. So it can be applied to all industries, like we did it for restaurants. That's the cooking area. This is for the banks, how we can help them. This is for manufacturing unit. So name an industry. This is for physiotherapy and occupational therapy students, right? So these are the various programs that we can offer. Now I would like to take a few questions, if I think this much is clear, because questions will help you. Answers to the question, your own queries will help you
Yes,
better. Yeah.
Doctor, thank you very much. The session was really informative, and we have few questions from our participants. The first question is, like, one of our participants is a teacher, and she stands for prolonged hours, and often she gets cramps in her legs. So how to avoid it? She wants to know how to avoid it, or solution to avoid cramps.
Absolutely, very good question. So basically, you have to stand for long hours, there is less muscle activity, especially in the calf muscles. right? So what you could do is alternate your standing and sitting. So whenever you don't have to really deliver your lecture, and whenever it is feasible, you change your posture from standing to sitting wherever possible. Apart from that, definitely stretch. So the particular calf muscle that she's saying that it goes into spasm quite often, that calf stretch is something that you can do. Just put a dupatta around your foot and pull the forefoot towards yourself, and the calf muscle will get a little stretch. Apart from that, a little bit of toe movements when you're sitting. Okay, so while you're checking your papers, or you're making your ppts for the next day, or preparing your notes, that is the time you're sitting, right? That's the time you need to move your ankle or your foot, so that ankle pumps happen. Ankle pump means actually pumping the heart, the blood, and fluids towards heart. So it's a good circulation exercise. So that's the reason we call it ankle pumps, and it's one of the easiest exercises that you can perform. You can also do it against resistance. So if you can push against a cushion placed against a wall, that will also help improve circulation. So stretch and this thing. Even standing on toes and coming back, standing on toes and coming back, that will also help you.
Thank you, doctor. Thank you. So our next question is, how long should you have to take rest if you are working in a smelter company?
In a
Smelter company. If you are working in a smelter company, I guess some metal refining company, how long
smelter.
you have to? Yeah,
How
smelter.
long you have to sit is what is asking.
Yeah, how long you have to take rest?
Okay, so depending upon what your work or job profile is in that particular company, okay, is this question for a worker who has to
Yeah.
stand? Hmm?
No,
So
no, you didn't mention that, but
yeah, so that's how. So it is not a one rule applies to all, because like I said, even in a particular manufacturing or a smelter company, what is the role that the person has to perform is what we need to understand. What is the job requirement? How long he has to sit, or how long he has to stand. What is the action that he needs to perform? What kind of muscles are getting involved? How much is the repetition? How much is the frequency? How much is the duration of that particular activity? That will decide. But more or less, if we have to define, we can just say that we should, if at all complete rest is not possible, then just change of that particular job, giving a change to those muscles that are being overused. For example, he's been using that particular equipment which involves holding for a long time. After 20 minutes, half an hour, whenever is the right time for him to take break, he has to leave that particular equipment, relieve himself from that this thing, and give the opposite movements to the involved muscles. So for example, if it was holding, then this muscle, these muscles. So these stretches are something they can perform at work. Neck rotations, neck stretches, all these are things that they need to involve in their daily routines. And obviously it's about 20 minutes to so after every 20 minutes, if we could give a change to the muscles, it will be great. And as for rest, we would say about 8 minutes of rest should be good after every 1 or 2 hours of work. So if it's a heavy work, otherwise just change of movement, change of muscle action would help a lot.
thank you, doctor. Thank you. So I hope all our participants got their answers. Thank you very much.
Okay, great. So I think so. Primarily, the idea or the message that I would like to share here is, no matter what you do, make good ergonomic practices a part of your life. Right? Over to you, Dr. Nagaraj. Thank you so much for inviting me here. It was a pleasure sharing whatever little I know with you all. Thank you so much.
Thank you, ma'am.
Thank you, Dr. Mona, for joining us today evening, and thank you, Dr. Nagaraj and his team, for giving this tremendous evening with a lot of informations. And thank you, Dr. Chandra, for taking care of this webinar very well. Thank you so much. And to all the attendees who have been frequently asking regarding the webinar certificates and feedback link, you will receive an email soon after the webinar. So you will get all the information regarding the feedback link as well as how to download your certificate. And thank you to all the attendees who have joined us in the live webinar as well as who have been watching us live from YouTube. Thank you all for joining us, and thank you to Dr. Vijay, Dr. Mona, and Dr. Nagaraj for giving us a lot of information, and thank you so much.
Thank you, Dr. Zisila. Thank you for your wonderful coordination with this webinar. And I take this opportunity to thank Dr. Vijay again once more, Dr. Mona Pankaj. Immediately said okay for this webinar. Thank you, ma'am, for your excellent PPT presentation, which was very useful and very knowledgeable. I think it would be very useful for all the professors who made it. So thank you, ma'am. And I'd like to thank Dr. Chandra for moderating excellently for this webinar. Thank you, Dr. I thank the IAN for hosting this, IAN and Biolix Worldwide for hosting this excellent webinar to the public. Thank you a lot. Thank you, Zisila.
Thank you all, and good day and good evening. Thank you for joining.